Hi everybody, I am Dr. Britt Talley Daniel MD, a neurologist and headache specialist, and I'm talking today on amitriptyline. Is it a preventive drug for migraine headache? I have several other migraine blogs up on YouTube. Well, the original drug was called Elavil. That's the name brand for the drug. But since it came out in 1961, most people know it as amitriptyline. It comes in dose sizes from 10 milligrams up to 100 milligrams. And the original indication from the FDA was for treatment of depression. And it's really the only indication it has. But it's had a side use in neurology for treatment of migraine, period. For treating depression, the doses are 75 to 150 milligrams, but for migraine, we use like 10 milligrams to 30 milligrams. So the question is amitriptyline a preventive drug for migraine? And the answer is yes, because the American Academy of Neurology current update for pharmacologic advice for treatment of episodic migraine for adults states that amitriptyline has moderate evidence of treatment success and should be considered for migraine prevention. And that's a quote of that site. So how do we dose amitriptyline? The problem with the psychiatric dose at 75-100 milligrams is you can have a lot of side effects there. And those could be weight gain, a dry mouth, excessive sleeping, and constipation. But lower doses, 10, 15, 20 milligrams, even up to 30 milligrams, for neurologist use for migraine doesn't have as many side effects, and they're more tolerable. But even at that dose, a low dose, 10 milligrams, early morning drowsiness can be a limiting problem with using the drug. And so many patients can take it, sleep through the night well, and they tolerate it well, but some patients report they're just too drowsy in the morning, can't get out of bed, can't go to work. So for that situation, I advise them to break the dose from 10 milligrams down to 5 milligrams, or try the 10 milligram dose earlier in the evening when they go to sleep. Like if they usually go to bed at 10, get up at 6, well, they could take the pill at 9 and then get up at 6, and most of the dose effect will be gone by then. What's this amitriptyline success rate used alone for migraine prevention? Well, it's about 30% reduction in headache. But another advantage for migraine is amitriptyline helps with sleep. Now for migraine, it involves with serotonin receptors, which are involved with migraine, but it helps stabilize those. So amitriptyline can help migraine through a neurochemical effect. But it also has a good effect on sleep. Now the problem there is that migraine patients have a lot of psychiatric comorbid illnesses, so that 50% of patients with migraine have depression, and 40% of migraine patients have panic disorder or generalized anxiety disorder. And GAD and depression both has cardinal common big symptoms, insomnia. So a lot of persons who have migraine are not going to sleep that well. Amitriptyline is not addictive. It's not like a benzodiazepine drug people take for sleep like Ambien, which is a class 4 narcotic. Class 4 drugs are narcotics like hydrocodone, which is addictive. And amitriptyline working on the dopamine receptors helps migraine and puts them into a deep phase of sleep. And sleep is good for migraine, and most migraine patients don't sleep well. Research studies that I've seen on migraine and sleep show that many migraine patients are in the beginning light stages of sleep, which are stage 1 or 2. The way that's classified is there's stage 1, 2, 3, 4. And you want to be in stage 3 or 4 sleep, which is good deep sleep like babies have. So if you take amitriptyline, many times you'll get into deep sleep and sleep well. Amitriptyline is also helpful, in my opinion, for nighttime or nocturnal migraine headaches, which come in the middle of the night, or sometimes a very frequent problem for migraine patients is early awakening or wake-up headaches. So if the patient, again, is getting up at 6 in the morning, they may awaken about an hour and a half before that at 4 in the morning, 4:30, with a bad migraine headache. If they don't treat it adequately and quickly, then usually with a triptan, they're in trouble all day long with a bad, distressing, disabling, throbbing, level 10 headache with nausea and vomiting. And I've always encouraged my patients to put their acute therapy drug, hopefully it's going to be a triptan like sumatriptan, at bedside with a glass of water so they can just roll over, take their medicine, go back to sleep if they get a headache, and then they're ahead of the game. Because always migraine patients should treat their headaches early with a triptan. Amitriptyline also works for tension type headache, which is about 70% of headache. And that dose there is 75 to 150 milligrams. And some patients with migraine will have tension type headache. And tension type headache, one of the defining physical symptoms is that they may have muscle tenderness when the doctor palpates their head. And amitriptyline helps with muscle tenderness. Okay, we're getting some good things about amitriptyline. It is a very inexpensive drug. Some insurance companies have it as free. Many times in Dallas at Walmart, it's like $2 to $3 or $4. It's cheap, and it's even cheaper than using your copay to pay for it. I tell patients just pay for it themselves. And it's also a very small pill. Now, I've had mainly adolescents or young people who can't swallow pills well, which is another kind of growing up experience, which everybody needs to get past. And they'll refer to the big old headache medicine that doctors have given in the past as being horse pills they couldn't swallow. So this is a tiny little pill that anybody could swallow or grind up easily and take with water or something. The other idea is that now most patients for prevention, if they can afford it, have good insurance and can cover it, they can get on the new CGRP drugs, which work so well. Headache doctors try to use an Aimovig, which was the first CGRP drug released in America in July of 2018. But I'd use a lot of amitriptyline along with sometimes other drugs for prevention of migraine patients before that came out. But I've always advised my patient, if I start a CGRP drug, for them to stay on their older migraine drugs just to see how they're going to do. And many patients will wind up wanting to stay on amitriptyline because it'll help them sleep, but no other drug for prevention of migraine helps people sleep. CGRP drugs don't do that. So then many patients will stay on amitriptyline and their CGRP drug, and they'll do well, sleeping well. So this is the end of a little note on amitriptyline for prevention of migraine. I wish all you migraine patients, sufferers doing well. God bless you all, and tune in for the next one when I put another note up. Thanks a lot for listening. Bye-bye.